Say they want to hold Steward accountable and do what they can to help patients and hospital workers who will be affected by this. 7's Jonathan Hall, live at Kearney Hospital in Dorchester with the latest. John.
Well, Kim, lots to this story, right? The governor says we are in a healthcare emergency, number one. Number two, she blames Steward. Number three, she says Steward has to work with its lenders. She says there is a path forward to save at least some of the hospitals, and she wants them to make a deal. In Dorchester, Steward Healthcare employees are getting some support today from the politicians, but they're frustrated.
We need somebody to tell us what the plan is.
While state law mandates 4 months' notice before a hospital can close, things are moving more quickly than that. A federal bankruptcy judge could grant Steward's request to close in several weeks by the end of August.
The only plan is a plan for an expedited closure. Our plan is to stop that plan. Stop that plan.
Steward filed for bankruptcy in May. The company is trying to sell off its hospitals, but say they have no qualified bids for Kearney Hospital in Dorchester and the Neshoba Valley Medical Center in Ayer. While this was a strong showing from powerful lawmakers, we spoke to longtime Kearney employees who fear nothing will be done to save their jobs.
So they're just here today to just make us feel that they're in support with us. But at the end of the day, I really truly feel August 31st is the end of Kearney Hospital.
But the congressional delegation insists it will do all it can because the stakes are high.
This will cost lives. If this hospital closes, this will cost lives.
Nurses who attended this event agree with the Congresswoman. They say many of the patients who come here for care are people of color in need of psychiatric and substance abuse services close to home.
I live in Dorchester. If I call 911 and Milton Hospital's right there, they're not going to take me to Milton. They're going to take you downtown. You're going to wait. People will die in the emergency rooms waiting for care. It's crazy.
Hospital employees in Ayer say they have the same concerns about the quality of health care going downhill, with local fire departments forced to make longer ambulance runs to hospitals in Nashua, Leominster, or Concord, and all involved face the unemployment line. The governor says Steward Healthcare is not to be trusted, but the state is providing $30 million in transitional funding.
I want Steward out of Massachusetts yesterday. And let me be clear as well, that money is not going to Steward. We have said, all of us, that not a dime goes to Steward.
She says the money will be controlled by Steward's lenders. Again, she wants them to make a deal, and she says the cash is in advance on Medicaid funding. We're live in Dorchester, Jonathan Hall, 7 News.